name is Dr. Josh Riley. I'm the Science and Education Director for Alpha-Stim, and thank you for joining us for our webinar, Using Alpha-Stim Adjunctively with EMDR in Complex Trauma Cases. We are excited to have Dr. Sandra Paulsen joining us. So let me talk just for a couple of minutes about Alpha-Stim. Alpha-Stim is a neuromodulation device. It utilizes both cranial electrotherapy stimulation to treat the brain and microcurrent electrical therapy to treat pain peripherally. What we're going to be focusing on today is mostly CES. There may be some MET discussed as well. We utilize a patented waveform. No other CES device on the market can use our waveform. And it's been proven safe and effective by well over 140 clinical studies, as well as 40 years of clinical experience with Alpha-Stim being on the market. The current that we use is less than 1/1,000,000th of an ampere. It's a very tiny amount of current. In the US, it is a prescription device, so you will need to write an order for your patients to be able to purchase one. We have customer and clinical support available 8 to 5, Monday through Friday. That is offered free of charge. Our devices do have a 5-year warranty and a 30-day money-back guarantee, minus a 10% restocking fee. I'm a clinical psychologist. I was using Alpha-Stim with the VA prior to coming to work for EPI. And in all of my years personally working with patients, working patients who are on medications, trying CBT, all sorts of different therapeutic techniques, I've never seen anything that worked as quickly, as effectively, or as safely as Alpha-Stim, which is why I now work for the company. It is extremely safe. There's no lasting side effects. Our side effects occur less than 1% of the time. Most common ones are a mild headache or some mild skin irritation, both of which are self-limiting. They'll resolve themselves on their own if you do nothing. Headache, you can turn the device back on and run it for a few minutes and the headache should go away. Skin irritation generally is just a little bit of redness. If it's irritating, you can use some over-the-counter ointment to clear that right up. There are only 2 contraindications for using Alpha-Stim. Pregnancy, simply because we don't have any clinical data regarding the safety to the unborn child, and an implanted medical device that cannot be turned off, such as a pacemaker or a defibrillator. We don't want the currents to interfere with each other. So that's a little bit about the device. If you're interested in our research, we do have all of our research online. So if you go to our website, alpha-stim.com, and you can see on the screen here, scroll up to the top for healthcare providers, go to research and reports, and you will have links to all of the research that we have on our indication. There's also how-to instructions for how to use Alpha-Stim on the website, instructional videos, the owner's manuals on the website. There's a lot of good resources on our website. So if you haven't visited it, I highly encourage you to. So now, allow me to introduce Dr. Sandra Paulsen. She is a psychologist and an EMDR advanced instructor. She's the author and illustrator of several books, chapters, and articles on EMDR and its application with complex cases. She's an international speaker and specialty EMDR workshop instructor for many years. I know the last couple of weeks when I've been talking to therapists, they were all very excited about hearing Dr. Paulsen speak. So very interested in hearing this webinar. She teaches workshops internationally as well as throughout the US. And she lives and works in beautiful Bainbridge Island in Washington. So with that, I will stop sharing and allow Dr. Paulsen to take the wheel.
Well, greetings, everybody. Very nice to be with you today. And I'm hoping that the storm stays settled down. If I suddenly disappear, it's because I live on a forested island where if a branch falls, it takes out the power. So, and one other disclaimer, if you hear any snoring, it's not me, It's my mini-me here behind me. All right, I'm happy to speak today about how I use Alpha-Stim in my practice. And I need to explain, I've got a peculiar practice. I work almost exclusively, and have for a decade or more, in the intensive format. That is, I work with people all day for usually 3 days. So I don't have a very conventional practice where people come in every week or two for 45 minutes or an hour or 90 minutes, with rare exception. So that's unusual in itself. I combine EMDR, ego state therapy, somatic therapy, and some of you know about the early trauma approach of EMDR, which is quite different than the standard EMDR in some ways. So most of my clients are themselves therapists, usually EMDR therapists or family members of EMDR therapists. And I may never have met the person before, except they may have attended a workshop or we did a phone intake, but here they are flying in for who knows what. And the cartoon there is to signify that they might be quite anxious or fearful or not know what to expect, because it's like walking in the dark. To the degree that we're working in implicit memory with the early trauma approach, there may be no narrative about what we're going to be working on, and they just may have a feeling of sort of dread or anxiety as very early disturbance starts getting close to the surface in anticipation of the work. So their anxiety can be quite high as they walk in, even though they're eager to do the work. Nobody made them do it. They signed up for it. But they have quite a bit on the line. I mean, it's expensive. It's 3 days out of their life. They've flown in. So drum roll, please. So it's not unusual to feel both excitement and dread at the same time. And, they're worried about, is it going to be continuous pain? So instead of peeling them off the ceiling with a crowbar or having them run out of the office with a flight response, because they, as trauma specialists, if there's a traumatic memory near the surface, it's often accompanied with an adrenaline response of fight or flight. So that's sort of coming close to the surface for the occasion. So they can easily experience that as wanting to run out of the office. Although I've never lost anybody, but that urge can be there. So one of the things I've learned to do is offer them an Alpha-Stim, and they typically will settle right down. Sometimes they're quite startled by how quickly they feel calm. I did have one person with a hideous trauma history, as so many of them are hideous, but this one, the person was tortured as a child with electrical shock and electrical devices. So they didn't want anything to do with the Alpha-Stim. And there are a few people for whom the issues are understandably about trust and mistrust, who don't initially warm up and say, hook me up. But that's very rare. Most people, especially in my clientele, most people say, sure, I'll try it. And then we're glad that they did. And then once they have used it on the first day, I'll typically have them use it on each of the days that they're in. Now, another application in my practice is when I have a complex trauma client who's acutely destabilized. I still have one or two people left over from before I turned to the intensive format that I see regularly. And so for those people, if they hit a pocket of destabilization, Alpha-Stim is very helpful for that. Because you can't do any work, whether it's EMDR or any kind of good therapy or life itself, if you're shut down or hyper aroused. So shut down and frozen, as you see in this cartoon here, is no way to run a therapy session. So the Alpha-Stim in that kind of an application helps keep the person in that optimal mid-range of arousal that Dan Siegel talked about and wrote about in 1999, because change happens in that optimal mid-range. So here's Siegel's window of tolerance graphic. We've got hypo and hyperarousal. We've got, and hypoarousal refers to numb, shut down, frozen, dissociated. Hyperarousal, when there's emotional reactivity, the person might be disorganized or flooded. And if the person's just vacillating between those two extremes, very little is going to get done. And the therapist is likely to have fantasy about tending sheep in New Zealand, because it's hard to work with people that are in that acute state. But if instead we can get people into that optimal mid-range, what Stephen Porges refers to as the ventral vagal state, where they're grounded, they're connected, capable of being socially engaged and resourced, that's where change can happen, whether it's EMDR or any other psychotherapy. So there will still be vacillations in that mid-range, of course. In fact, you want that. If I've got somebody wearing Alpha-Stim, I want access to their emotions, and the Alpha-Stim is not going to prevent access to emotions. So let's talk about how I use it in terms of my EMDR work, because I'm a seriously dyed-in-the-wool EMDR therapist. For me, the question is not when it's a trauma survivor in my office, and that's pretty much all I work with, including attachment injury, early trauma, neglect, big T trauma, any kind of trauma. So anybody who walks in with any kind of trauma, the question is not, am I going to use EMDR, but when? And as you know, in EMDR phase 2, the preparation phase, that's where we either quickly prepare them or take whatever time is necessary to prepare them in the more complex cases, which I've written and spoken about extensively elsewhere. But in phase 2, then, Alpha-Stim is one of the options available to immediately downregulate, but also to teach downregulation. So people, after they've used Alpha-Stim regularly and they become aware of what it's like to be in an alpha state, they can use the information like almost like neurofeedback to learn what it feels like to get yourself into that state. I don't know that I've ever heard the Alpha-Stim people talk about it that way, but that's how I think about it. I don't know that there's any controlled research to prove that point, but that's my impression, my clinical impression. So certainly the major application in my practice is for to prepare phase 2, which if somebody's flown in for 3 days, it may just be the first hour that they're there. So additionally, between phase 4 desensitization sessions, the Alpha-Stim can be helpful to help modulate any continued processing or acute activation between sessions. The Alpha-Stim also has application for EMDR phase 7, the closure procedure, to help close down a session. If it wasn't closing down by other means, one can add Alpha-Stim to help get people into a calmer state. I don't usually use the Alpha-Stim during EMDR processing, but I sometimes do. The most prototypic example of it is for OCD, and through the S. Frankel group, there's a workshop I talk about using EMDR and exposure and response prevention and ego state therapy to treat OCD. But in, I think, both examples, I've got the person wearing an Alpha-Stim, so I really should list Alpha-Stim as part of the treatment configuration for those people. And the reason it's handy there, for those of you who know about exposure and response prevention and OCD, the whole point of exposure and response prevention is that you're exposing people to their most warded off, horrific thought while preventing them from practicing their compulsion. So, for example, with the hand washer, you may have a tape saying, and you're dying, I'm dying a slow, lingering death of germ exposure, and you're preventing them from washing their hands. So as you can imagine, that jacks up the anxiety pretty intensely, and the whole point is to have that anxiety extinguish. So the Alpha-Stim can keep that in the dull roar range so that they can tolerate the treatment, because exposure and response prevention can have a high dropout rate. The use of EMDR with it really helps make it manageable and go fast instead of the many, many long hours required with exposure and response prevention alone. So to make a long story short, Alpha-Stim can help keep that optimal mid-range when working with OCD or really any other condition. I mean, I wouldn't want it to interfere with accessing what needs to be accessed. Now, let me go back and finish that thought. Any EMDR session where I have used Alpha-Stim during the processing, I will want to go back and check the target without the Alpha-Stim to see if there's access to additional reserves percolating up of unprocessed material. And I really haven't found that to be the case, but that's the responsible, careful thing to do. So some clients will want to purchase an Alpha-Stim for themselves for use at home. So I typically have a couple for sale in my office, or I have added a link on my website so they can link in to purchase an Alpha-Stim for themselves. I don't loan out mine. I have two that are in use, one for myself, and that's the Alpha-M model, which I'll explain in a bit. And the other is the Alpha-Stim AID model, which just has the ear clips. And that's the one I typically use for clients. I have one that's dedicated for clients. You just have to change the ear pads between clients. And during COVID times, I also wipe things off. It's probably a good thing to do anytime. So clients report that it's helpful for between session anxiety, certainly complex cases. And they also find that it's helpful with insomnia. It's good for incomplete processing. As you can imagine, if they left your office during an EMDR session and their SUD level is still 6 or 7 or something untoward, then of course we'll ask them to take time in the parking lot to calm themselves using whatever methods you prepared them with. But if they have an Alpha-Stim, all the better. And I want to be clear that I'm not saying use Alpha-Stim instead of a careful closure procedure. There should always be a closure procedure. And certainly if you're using ego state therapy, and I've written and spoken about that extensively. Some of you have heard about the so-called Paulsen two-step named by my colleague, Joan Galston, which has 3 steps. The third step is only required when there's perpetrator introjects or fearsome parts of self that don't want to tuck in. So I'm not saying skip that. I only have one DID client. Actually, that's not true. I still have 3, I just realized. It's just the two are so high functioning, I barely think of them as DID. But there's one and only one DID client that I've used it with so that she could tolerate processing. And then, as mentioned, we went back and checked the targets without Alpha-Stim to make sure that the targets really were clear. And the other two DID folks, I wouldn't hesitate to use it in office. And in fact, as I think about it, I'm sure I have. But neither of them really require it. It's just optional with them. And I've already mentioned it helps people to learn down regulation. Once you've been able to come and go through an alpha state a number of times, you can begin to approximate creating it yourself. So theoretically, they wouldn't need the Alpha-Stim, but it's really nice to have one. All right, so here's a case example of a DID client who also had OCD, depression, PTSD, agoraphobia. So she's got quite a lot going on. And she had a very hard time leaving the house. And because she lives alone, it was on her to get her grocery shopping done. And she would sometimes not go out of the house even when she needed groceries. I did not recommend Alpha-Stim for her home use, but I would have her wear it when she was in the office. Well, she arranged for her adoptive family. They purchased her one for her home use, and she decided to get it. I'm not sure how, because I don't think I signed off on it. So she got some other practitioner to sign off for it. Anyway, it turned out to be a good idea. I don't think she asked me about it, but she wears it, or else she did and I've forgotten. That's possible too. But she wears it when she goes grocery shopping. Otherwise, she's too anxious to be out in public. So it looks like earbuds when she's wearing it. The ear clips look like, they don't attract attention, especially if you have a mask on top of that. And so it's really changed her life in a good way. At the very beginning, she overdid it once, or at least she believes that she overdid it. And she believes that she suffered for a few days as a result of overusing the Alpha-Stim. Now, the tricky part with her is that her system gets very easily rattled. And there's been many times and ways that her system felt like something was too much or overdone or dangerous. So I'm not entirely sure if she did overdo it or not. But I wouldn't ever tell anybody the more the merrier. Use it as directed. Now I want to talk about Alpha-Stim used neuroaffectively within what I call NEST. And there's an article about NEST on my website. I think it's also it's either on the store page or the For Professionals page. And NEST, the acronym, stands for Neuroaffective Ego State Somatic Therapy. So neuroaffective science, ego state tactics, somatic tactics, all integrated within the 8 phases of adaptive information processing therapy. So what I've been trying to do is systematize when you do how much preparation for whom and why and all that. A cornerstone of how I think about the work I do is that the patient's symptom constellation are shrines to the untold, unheard story that the client is stuck in. And that certainly when it's very early trauma, much of it's unconscious, but even when it's always somewhat unconscious generally. So symptoms are shrines. So the way I think about it is that, and here I'm referring to that N in NEST. N stands for neuroaffective. And there's these various devices and methods that we can use to interrupt those stuck neuronal pathways, because the brain just wants a chance to get out of its rut. Those are ruts, that muddy road. If you've ever driven a bicycle down a rutted road like that, you know that the only way you can get your bicycle out is to put your feet down and lift the bicycle up and out. You really have to interrupt. And so I think of Alpha-Stim as one of those neuroaffective interruptive methods, along with EMDR itself is that, and lens neurofeedback, and the photonic stimulator, and other things like Reiki. They all either add energy or interrupt processing. And I saw a hand went up. I will take questions in a few minutes, but I want to get through the slides, and then we have plenty of time because we've got a large group. So now I want to say a few words about how I use Alpha-Stim for myself. And I want to say sort of greedily. For example, the minute I get done with this talk, I'm going away for a weekend with my husband, 4 days up in the Olympic Peninsula. And I'm taking my various devices with me. I will certainly have my Alpha-Stim with me. One of the ways that I use Alpha-Stim is when I'm traveling, and Josh mentioned, Dr. Bradley mentioned that I travel and teach all over the world, or I did before COVID, hope to again. And the world is full of cobblestones, it turns out, like who knew? And you can easily twist an ankle, and those pictures are from Peru, I think, although the one with the feet in it might be somewhere in the UK, Ireland or something, I'm not sure. But the point is there's all these hazards, not to mention twisting your knee, throwing your luggage around, or back pain from lifting luggage. And I'm pushing 70 years old. So every time I travel, something happens. So I take my Alpha-Stim M with me because the M part, the body attachments really solve most of my temporary or even chronic pain kind of issues. Now, I'm not saying you don't need to see a doctor, but if it, for me, speaking just for myself, a twisted ankle, a sore knee, or back pain, the kind that you get on cobblestones or traveling, that I'm always really glad that I brought my Alpha-Stim with me because it helps with that. And you don't have to be traveling. Obviously, I use it at home too. So another application of the EMDR for myself was I was working with a client who had an especially horrific trauma, big T trauma to process. I won't name it because you don't need it in your head, but it was not your garden variety hideous trauma. And I use the Alpha-Stim for myself anyway every day. So I said to the client, let's do an experiment to see if we can get both of our energy fields in alignment with the same alpha waves, and maybe it'll support your processing too. It can't hurt. And of course, it was helpful to me to take the edge off of a particularly disgusting trauma. So, and we both felt like we were in a coherent energy field. I don't know if we really were, but we both believed we were, and that's probably the ingredient that's necessary anyway. So there's lots of research on its use for insomnia, and I've had trouble sleeping for decades. And what I'm one of those people in New York Times wrote an article about 2 sleeps. My husband calls me Sandra 2 sleeps because I fall asleep easily, and then I'm up for hours, and then I sleep again. And so I'm always looking for ways to shorten that period of time that I'm awake in the middle of the night. And prescription sleep aids are not wanted by me. I don't want to use them for lots of reasons. And what I've settled on now is a regime that really helps. And the cornerstone is the Alpha-Stim, which I use for 40 minutes a day, which helps with my insomnia. I don't think 20 minutes does the same for me, although I should do that experiment again. And so I'm still awake for a bit, but it shortens it down to 1 hour, maybe 2 hours, especially if I use it with melatonin And my most recent discovery is golden milk, which has turmeric and pepper and other delicious spices. It's an ancient remedy from India. And it seems to me that if I do all of those things, then that gets the best result. But if I forget the Alpha-Stim, I'm up for hours. So in summary, I love my Alpha-Stim aid for my clients. Not everybody needs it, but many benefit from it. Primarily for managing anxiety in session, but also for home use for the people that want one or would benefit from one. And I love my Alpha-Stim M for myself for insomnia and for pain. I mean, if I were anxious, I would use it for that, but I'm not particularly anxious. I just have insomnia. So, or if I were depressed, I would use it for that. So insomnia and pain is how I use it. And, you know, sometimes people say to me, which one should I buy? Well, if you only have one that you're using for yourself and your clients, why not get the M? Because then in the event you twist your ankle or have some other pain application for it, it's right handy, whether it's the adhesive pads or they got these little probe things. I forget what they're called, but they're handheld and you put them on the knee in position around the source of the pain. 10 seconds each position. So depends on where the pain is. Like on my low back, I want the adhesive pads. How would you even do that back there? So I love it. And so if you only have one, I'd recommend the M, even though it's more expensive. But if you can, like I do, I have one dedicated for clients. I'm not treating pain in my clients because I'm not a physician or a medical professional. I'm treating psychological things. But for myself or for anybody who's aging or intends to age, I'd recommend the M.